6 in 10 Americans are living with chronic illness, yet many are not aware of their condition until they're hospitalized. Well, that's why health screenings are so important. DaVita, a leader in kidney care, is teaming up with the American Diabetes Association to bring those resources directly to underserved LA neighborhoods at no cost. I'm joined by Gardner, the executive director for DaVita Giving Foundation, to learn more about this. Thank you so much for being with us this morning.
Thank you for having me. I really appreciate it.
Yeah, those numbers are really scary. So it's part of the reason I'm sure it was important to launch this initiative here in LA.
Absolutely. At DaVita, we know that early detection and access to resources is so critical to help people better manage their health, which is why we're providing the community health experience where we, as you said, provide no cost free kidney health screenings, where we're really testing people for the root causes of kidney disease, including diabetes, hypertension, and then getting them the health resources that they need to empower them to better manage their health.
And why specifically focus on kidneys?
You know, kidney disease is an interesting disease where oftentimes people don't know that they have kidney disease. And so, but by testing people early, getting them the information they need, things like hypertension, diabetes, we can ultimately change that trajectory and empower people with the knowledge that they need to change their lifestyle or the behaviors to better manage their health.
Yeah, literally changing and saving lives. So these screenings are going to kick off today. You were telling me they run for a bit. Give us all the information on how people can get them.
Absolutely. We're kicking off today at a local community nonprofit organization. We'll have screenings on October 3rd as well as October 10th. They are free, no insurance needed. We have the opportunity where people can make an appointment or they can walk in to join us for one of the health screenings.
This is awesome. And so what kind of health screenings are there besides the kidney?
Yes, so we're testing people. You'll test it for their urine, a blood sample, as well as their vitals. And again, they will walk away with a handout with all of the information that they need. We'll have providers on site to consult with individuals, to provide them with health resources, and then they can take the information home with them to meet with their doctor or, again, with some key tips and tricks to better manage their health.
Awesome. And when we talk about health issues like these, of course, there are more areas that are more vulnerable, of course, because of a lack of resources often. So how do you make sure areas that really need this are getting it?
We are thrilled to do these screenings here in LA and the other markets that we have been in partnership with community-based nonprofit organizations. We know that the partners that we're working with, they are trusted resources in the community. We're coming alongside free food distribution days and having other health resources. So again, it's where people have already been. It's a resource that they trust, and then we're coming alongside them to provide the free screenings.
Yeah, this is absolutely amazing. Okay, so someone comes to this event, and I'm assuming it's often probably people who are uninsured. That way they have the free cost, which is a huge thing here. And hopefully this sets them up on a trajectory to go to more events like this, or at least connect with a doctor and take some of these preventative measures.
Absolutely. At the health screenings, DaVita will have health educators there that will provide individuals that go through the screening, both with key takeaways for that day, but then also ongoing resources that they can access alongside the nonprofit organizations that we're working with, so that they have that continued education that they need beyond just the one-day screening that we're providing.
This is also important. Liz, tell us where people can get more information.
Yes, so I would encourage people to go to communityhealth.davita.com. Again, you can sign up for one of DaVita's free health screenings today, or like I said, walk-ins are welcome. No appointment is needed. No insurance is required. But again, DaVita, communityhealth.davita.com for more information.
All right, Liz, thank you so much for being with us this morning.
Thanks for having me. I appreciate it.
Of course. All right, now